All right, we are now allowing all of the participants into the webinar. And once we have a decent number of people, we can officially begin the webinar. So let's just give it maybe about 1 more minute. Okay, so I hope all of you can see our faces. So a very good morning. Hope you've had a lovely Tuesday morning so far. Okay, more and more. Very good morning to you, City. Yeah, good to see the chat box being so lively as always. So if you have anything to say or ask, please feel free to put it in the chat box and we'll definitely get it back to you. Noliana, good morning to you as well. Yeah, everyone is very enthusiastic about this. Okay, so, oh wow, we have quite a number of participants today. It's over 60 so far. That's a very good sign. So, for those of you who have just logged in into the webinar, a very good morning to you. And so, on a side note, I have not done a webinar since last year. For those of you who may be familiar with me, I am Amanda from Cancer Research Malaysia, and I am one of the very few science communicators that do monthly webinars. But due to some time constraints and also with regards to the holidays, I haven't been able to do a webinar recently. But today, I have a very, very special guest joining us for this webinar is Dr. Yogeeta from Universiti Malaya Specialist Centre, or UMMC for short. And today we are going to be discussing about something very interesting and which I think every woman, every Malaysian woman, they need to know about it, and that is cervical cancer. So, what do you know about cervical cancer? It's actually one of the most preventable types of cancers, but it's called the silent killer. And so today we're going to talk about a range of things like screening and prevention, as well as learning some very important and essential facts that you Malaysians should know about. This is the sixth most common cancer here in Malaysia, especially among Malaysian women. So that's why it's very important for us to spread awareness and, when the time comes, we'll know how to take action. All right. So, Dr. Yogita, you can unmute yourself now and join me. So, how are you feeling today?
Hi everyone, good morning. Thank you for having me. Like Amanda said, I'm Yogi. I'm an obstetrician gynecologist, gynae-oncologist in Universiti Malaya Medical Centre and also UMSC, the Specialist Centre. Um, I'm actually quite excited because this is something that is very close to my heart. I think cervical cancer is something that we all need to know about because it is a very treatable, preventable disease.
Amazing. So, I think that we're going to have a very interesting discussion today, Yogita. So, are you ready for the questions that I have for you?
Yes, nervously ready, but ready.
Okay, perfect. So you have already briefly introduced yourself. I think people know that, wow, she's a doctor. She looks very professional, and you're also dressing your scrubs right now. So definitely 100% legitimate. Okay, so we are going to talk about cervical cancer. So, what is cervical cancer, and what is the situation on cervical cancer here in Malaysia? So, could you tell us a bit more about that, please?
So, maybe I can share my slides. I've prepared a few slides so that it's a bit
Oh,
more
yes, please
interactive
go
and
ahead. Go ahead. I
let
think
me
people
do
would
that.
actually appreciate a visual so that they can better understand the
Yeah,
disease. Yeah,
so,
it's useful.
okay, let's do this. Now, so
Awesome.
cervical cancer is actually the third most common female cancer among Malaysian women. Now, you see this more often in ladies aged 15 to 44. So these are the very young reproductive age group women that unfortunately is affected by this disease. And if you, by the end of this talk, you will understand why it's such a big discussion that everyone is having, not only in Malaysia, even until WHO, because this disease or this condition is actually something that's very treatable and very preventable. Um, in Malaysia, if you look at it, we have about 1,007 to 2,000 new cases a year, with about 100 to 200 deaths every year. And we are at an era where we are not supposed to be losing our loved ones to cervical cancer. And I'll explain to you why in a few moments. Um, so how does cervical cancer happen? How does this happen? Why am I saying that cervical cancer is something that's so preventable? Because unlike other cancers, like the breast cancer and your ovarian cancer, that can be something that's inherited or like a genetic predisposition that happens in a family, cervical cancer is actually caused, 99% of this condition is caused by one virus called human papilloma virus. So it's a HPV virus, which is a viral infection that can happen to any one of us. And if it is persistent in the cervix for over a long period of time, it's then that this HPV virus can make changes on the cervix to then cause cervical cancer. Yeah. So there are many types of HPVs around. We have about 200 over HPV families around. But what are we worried about, or what are we interested in? It's the high risk HPV that
Mhm.
we have about 12 to 14 high risk HPVs, and these are the main cause of cervical cancer. We're not
So
worried about the low risk. We're not
are
worried
they
about the rest.
actually numbered? Like the names go by numbers because I can see that
Correct.
there's like 16 and 18. So I'm assuming that the ones which are the biggest and colored in red are like the most dangerous ones?
So I always tell my patients that they are the gangsters of the high risk HPV group.
Ah,
So if you look at the
yes.
16 and the 18, so you see why I've put them in red is because these two 16 and 18 HPV subtypes actually cause more than 70% of cervical cancers.
Ah, I
So
see.
yeah, so that's why they have a higher rate of being more persistent in the cervix, and they are the higher sort of the gangsters that can cause the disease over a period of
Mm.
time.
It's like the biggest and the baddest and the meanest gangsters.
Yeah, the
So,
biggest and the
wow.
baddest and the meanest.
If you're fortunately infected with this type of HPV, that means you have a high risk of developing cervical cancer. Did I get it right?
If you don't have the ability to get rid of the infection. So remember I said that 80 to 90% of us at some point will have an
Yes.
HPV infection. That
Yes.
same 80 to 90% of us would have been able to clear the infection within a
Oh.
year or 2 years. So the key word really here is a persistent infection over a long period of time to cause
Mhm.
any changes on the cervix.
All right, we got it. Okay,
Yeah,
perfect.
yeah,
So I think everyone is just as curious as I am because cervical cancer happens internally. So it's not like
yeah.
something that we can see on the skin or on our faces and whatnot. It's inside a woman's body. So what are some early symptoms or some common symptoms of cervical cancer that if we notice it, we'll have to go and see our doctor?
Okay, so a lot of patients come in and say, "Oh, I've got a little bit of bleeding. I'm worried about cervical cancer, or I've got, this and that and the other." But the first thing I want everyone here to know that is, if you do have a HPV infection, it's very asymptomatic. You don't have symptoms related to it.
Oh,
So
oh, that's
no
scary.
symptoms with a HPV infection. By the time you start having any symptoms that is related to cervical cancer, which means there's already a growth on the cervix. So, what we are trying to do is we don't want to catch cervical cancers. We don't want to be at this era that we want to diagnose cervical cancer. We want to try to catch our women in the 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 few years before it becomes cervical cancer, which means we want to try to catch a woman in the pre-invasive stage. That's why we always, always, always emphasize in screening. But to answer your question, signs of cervical cancer could be persistent or abnormal bleeding. Now, if you look at the diagram I had earlier, let me go
Mhm.
back. Let me
Yeah,
go back,
sure.
go back, go back. Okay. So if you look at the uterus, now the uterus consists of the uterus itself and the cervix down below. Then you have your
Yes.
ovaries, then you have your fallopian tubes. Now, when we talk about cervical cancer, we're talking about a growth that is just sitting at the cervix. So you may have bleeding after sexual intercourse.
Mm-hmm.
You may have, if the growth is sort of infected or um, inflamed, you might have some foul smelling discharge. By the time patients present to us with abdominal pain or pelvic pain, most often than not, the cancer is already quite advanced. So the early symptoms would be um, abnormal bleeding,
Okay.
bleeding after intercourse, or
Okay.
foul smelling discharge. So if I always tell my patients, if you have symptoms that, okay, you have a little bit of bleeding after intercourse, you go and see your GP treats you for something. And then the symptoms persist and it comes back again and again, means something is not right. Then instead of going to a GP, go get yourself a gynecologist who can then have a look at your cervix and see whether there's anything that needs to be done further.
Oh, okay. That is very straightforward. I understand what you're talking about. Yeah, it does sound a bit scary though, knowing that you have to start bleeding, because people usually think that, oh, if something is bleeding where it should not be bleeding, that's usually a bad sign. So to think that
Mm.
we have to sort of wait until we can get like further clarification on whether or not it's cervical cancer. It definitely sounds very scary, actually.
That's why you don't have to wait, Amanda. That's why
Ah,
we're encouraging all our women to be screened because
yes, absolutely.
if the whole thing here is that we need to understand that screening for cervical cancer actually saves lives.
Yes, definitely, of course. So,
Yeah.
speaking of which, how can cervical cancer be prevented then? Since you're talking about screening, so let's talk a bit about prevention as well. Or
Okay,
if you have
so
any other slides that you want to
let me
elaborate
see.
on.
Let me
Ah,
see.
yes.
So remember, I was telling you all regarding cervix that's normal, that takes a long time before it becomes cervical cancer. So a
Yes.
normal cervix being infected with HPV, and then it becomes pre-cancer, and only then it becomes cervical cancer 10 to 15 years later. So how are we going to prevent this? It's a very, very, very good question. So even with WHO, number one, the the goal and the aim is to ensure that all our countries can eliminate cervical cancer. So we've got three pillars to it. The first one is HPV vaccination. The second one is screening. And when we speak about screening, we're not speaking about pap smears anymore. We're speaking about HPV testing. And I'll explain to you what's the difference between a HPV testing and also a pap smear. And also, for those patients who need to be treated, we want to be able to offer treatment to all our ladies who need it. So if we can achieve a 90% vaccination, a 70% screening, and 90% of patients or women who need treatment to have the treatment that they need, then we're on the right track to eliminating cervical cancer. And that's our goal. So the three steps, and Malaysia has done all three quite well. The first is the HPV vaccine. So for the HPV vaccine, what actually started, if the participants out here, you all have kids that are school going kids, you all will know that we've started school-based vaccination in 2010. Yeah, when COVID came, there was a bit of a abrupt stop in it because everyone is concentrating on COVID, but we're in the midst of trying to restart this. So HPV vaccines, a lot of patients ask, do I give my boys vaccinations? Do our boys need vaccinations? So obviously the first important cohort will be the girls aged as soon as 9 up to 45 years of age. But if you are a parent who has a boy, my nephew would have the vaccine, because boys also do get benefits from having extra protection from the vaccine. So the vaccine, we've got multiple studies saying that the vaccine is safe and effective. Up to this point, we have vaccine against the 9 high-risk HPV types. Not for all, but what we know is that if you get the vaccine, you do get some cross coverage with protection from all the other vaccines as well, all the other strains as well. Yeah, so HPV vaccines, we've done really well in Malaysia. And we're still in the midst of trying to roll out more vaccinations. So for those who don't, unfortunately, like for me, I didn't fit the category of having vaccines free being given in schools. So when the
Yes.
vaccines came out, I had to purchase the vaccine and I got the vaccination when it was needed. The vaccine is most effective when you give it to someone who's not had any um, sexual exposure. That's when it works the best, but it doesn't mean that for us who've had sexual exposure that we are not eligible to get the vaccine. Okay?
See, oh, this actually throws me back to when I was in secondary school. Yeah, now that I think about it, this is the exact vaccine that I got quite a few times. I think it was at least three times. So they would, I think, because I was born in 1999, so I definitely did get it for free at my
Yeah.
school. And maybe for the young ladies here who were born in 1997 onwards, I think you would recall that your school actually did, like, gather all of us girls, and then all the girls were panicking because, they were afraid of injections. And yeah,
Yeah.
they got the nurses to come and they actually gave us the vaccine. Yeah. So I'm actually curious, Dr. Yogita, because I know for a fact that some vaccines, a few vaccines, I don't know what is the name for them. Even if you have it administered to you at a young age, but later in life you have to get vaccinated for the same thing again. So does this actually apply to HPV, or is it just like a one jab? You got it and like maybe you were in secondary school and you don't have to take a vaccination again when you're an adult?
It's a very good question, Amanda. So for the HPV vaccine, you don't need boosters. Like you do, if you remember your hepatitis B, sometimes they check your antibody levels and they say, oh, you need a booster dose of vaccination, but
Yes,
not for the
yes.
HPV vaccine. So from the data that we have up till now, so the protection and the immunity that the HPV vaccine confers to a girl is long and it is quite good. So
Very good.
as for now, with the data that we have, as I speak to you now, there's no need for a revaccination, or there's no need to sort of vaccinate a girl or a boy again.
Ah, that's right.
Yeah,
So you mentioned that boys can also get the HPV vaccination.
vaccine.
So therein lies, forgive me for my ignorance if I'm asking this, but boys don't have cervix, sis.
Yeah, you're
So
absolutely right.
I am quite confused. So what exactly happens if, say, for example, a boy or a man gets infected with HPV? Like, what's going to happen to them since they don't have a cervix? So, where does the virus target instead?
So, a very good question as well. So, for the HPVs that affect us girls are different from the HPVs that affect the boys, or to a certain extent. So remember when I showed you the slide of the high risk HPV and the low risk HPV, the 6 and
Yes.
11? So the
Yes, the
6
one.
and 11 causes warts. So it can cause anal warts, penile warts. Um,
Ah,
so boys get protection and these warts for the men then change into anal cancer, penile cancer. You
oh,
also have throat cancers that are caused by the high risk HPVs as well. So we're not only speaking about the cervix, so we're speaking about all the other organs that are also susceptible to HPV infection. So we're talking about the throat, we're talking about the anal opening, we're talking about the penis as well. So boys get protection in that way.
oh. I see. But
Yeah.
all any of the boys in my school getting the jab. That's why it's only girls.
Yeah, because it's a
Really?
cost issue. It's a cost
Okay.
issue. So if you the idea behind all of this is if you give the girls the vaccine, then it's a cohort immunity, you know.
Ah,
So you vaccinate the girls first. And I mean, in the future, what Australia is doing now is that boys and girls get vaccinated with HPV vaccines. So
I,
hopefully Malaysia gets to that someday.
yeah, that's interesting. So, I think that any of the not had the HPV vaccination, they should go and do it soon.
Yeah, I mean, if you've not gotten your vaccination, go speak to one your gynecologist or get your vaccine.
Awesome. Yeah, vaccines are good after all. It's
Yeah,
completely beneficial. Okay,
yeah.
interesting. So, besides vaccines, what other prevention methods are there
So
for cervical
that's
cancer?
our first pillar. So we're talking about vaccination to protect yourself, to make sure you have immunity against the HPV infection. Then let's go to cervical screening. And I want to take this moment to explain to the participants out there what the difference between a pap smear and a HPV PCR test means. Okay, so remember the first slide I showed you with the uterus and the cervix? Now, can you
Yes.
imagine a cervix? Now, if I'm doing a pap smear, what does it mean? It means that I'm putting in a speculum into the vagina, I'm looking at the cervix, I'm using a little brush to brush off cells on the cervix so that I can now send this to the lab, and the lab will then look at the specimen and tell me, okay, the cells on this cervix are normal, or the cells on this cervix are abnormal. So basically, that's a pap smear. Now,
Okay.
what is a HPV test? A HPV test, which now in Universiti Malaya, we even do it like a self-test. So patients, I don't even need to have a look at the patient's cervix or whatever. It's just like a COVID swab, but the patient swabs herself in the vagina. So what the HPV test does is it lets us know whether that cervical vaginal fluid has a HPV infection or not. So it's very different. It's two different tests. So
Okay.
what we used to do in the past when we didn't have a HPV test was we used to look at abnormal cells. But what we are doing right now is we're trying to find out and screen to see whether there's any virus that may cause infection in the future. So we're going one step ahead, one step before. Because the other thing I want everyone to know here is that if you do have a HPV positive result, it is not the same as having cervical cancer. It just means that, yes, you have an infection, and we have to have a closer look at your cervix to make sure that there are no changes on the cervix or no abnormal changes on the cervix. That's all.
Okay,
So
makes
the
sense.
difference between a pap smear and a HPV test is very, very different. So in the past, when we didn't have the HPV test, we used to do pap smears. But what we're trying to do now is that we do HPV tests. So if you're a if you're a healthy woman, right, and you've got no medical issues, you're not immunocompromised, and everything is okay, you should at least have your first HPV test by the age of 30. If that is normal, your next test can be 5 years. So you don't need to do a pap smear yearly. You don't need to do a HPV test yearly. You just need to do your test every 5 years. So in some low resource countries, the guidelines even say that if you do at least two HPV tests in your lifetime, you have a possibility of avoiding
Mhm.
cervical cancer altogether.
Sounds
Yeah,
like
so
good
it's a
news,
very
actually.
sensitive test. Yeah, and also because now you can do it on your own. So ladies are a bit more, they're not as shy because
Ah, yes.
they don't need to undress, and they don't need to have a doctor put in a speculum and do such an invasive procedure
Yes.
for.
I think a
Yeah,
lot of us, I think a lot of women, I haven't done a pap smear personally, but female relatives, my mom, my aunt, and my grandma, they've done pap smears and they've always described it as uncomfortable and painful. So I think a lot of
correct.
women would be very relieved to know that they can avoid that discomfort and pain and do a test all by themselves at home instead.
Correct.
Yeah.
And that's what we want to do. We're trying to change, we're trying to improve with new technology, anyways. So that's cervical screening. And that's the difference between a pap smear and a HPV test. Okay. And then obviously the last um, pillar would be the treatment. So
Mm.
HPV positive does not mean cancer. HPV positive is if it is persistent over 10 to 15 years, and if we don't have any screening, if we don't have any regular checks, then it may progress to cervical cancer. But we're talking about a 10 to 15-year follow-up, 10 to 15-year period before HPV causes changes on the cervix. Now, so for patients who have HPV positive, the first thing I always tell my patients is don't be anxious because HPV does not mean cancer. All you need to do is a simple procedure where we, the gynae oncologists, we use our microscope. We have a quick look, just 5 minutes before coming up to give you a talk. That's the procedure I was doing. Having a look at a woman's cervix under microscopic magnification to make sure that there are no changes on the skin of the cervix. If we needed to take a biopsy, we take a little biopsy so that we are sure that we're not dealing with a pre-invasive disease or cancer. It takes 15 minutes to do the procedure. I started the procedure at 9:30. I was a bit nervous as I thought I was going to run late, but I was done at 9:45 and I'm here to
Oh,
give a
it's
talk. So it's a very simple outpatient procedure that needs to be done.
okay.
So those are the three things. If we are able to vaccinate our ladies, screen our ladies, and treat those who need treatment, we can get rid of this infection
Very
or this
good.
disease.
Very good.
Yeah.
Okay, great. So we basically know the three types of preventions and also sort of treatment for cervical cancer. So now let's move on to the next part, which follows up perfectly to this prevention methods. So if cervical cancer is detected, if it's 100%, it's not just HPV positive, it's cervical cancer positive. So what are the treatment options available?
Okay. So we need to stratify it to the patient that we are seeing. Okay. And we need to first see what stage of disease that we're seeing. If it's early disease, sometimes if I see early disease in a young lady, all I need to do is take a big biopsy of the cervix. And then if the margins are clear, if everything is okay, that's all they need. And then they need further follow up according to our guidelines. If I'm seeing a lady who has completed her family, she tells me, Doctor, I don't want any more children, and she's got early disease. My job is to remove the uterus and the cervix and then send that for testing to see whether she would need additional treatment or not. But unfortunately, and this is something that we see quite common in our countries, that patients come when it's a bit too late, which means that the growth on the cervix has gotten big or it has spread a little bit to the lymph nodes. And in this type of cases, surgery will not be amenable anymore. So we'll need to subject the patient for chemotherapy and radiotherapy and further follow up.
I
So
see.
what we're still trying to do is we're trying to catch it before it's cancer so that all patients would need is a colposcopy and a biopsy and removal of the affected part of the cervix and then monitoring. But if patients do come at a later stage, then surgery will not be something that's amenable anymore. Then we have to obviously offer them chemoradiotherapy.
I see, I see. Okay, sounds I think those are very common treatments for cancer. Usually we think of surgery or we think of radiotherapy and chemotherapy. I think the same also applies to cervical cancer. But I think, like you said, there are a lot of factors that changes the solution that you'll be offered. So it's like your age, and how serious it is. So obviously, if it's more serious, then you'll have to go for a more invasive treatment, right?
Yeah, yeah,
Okay,
that's right.
okay, great. So I'm sure that like many other diseases in this world, cervical cancer shares its own um, myths. So maybe can you perhaps like tell us maybe one or two common myths that is believed not just in Malaysia but also worldwide, which is completely wrong about cervical cancer? And can you tell us how it has been debunked?
Can, of course.
Okay,
Um,
that's perfect. Let's
this
go.
this is something that is very, 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 very close to my heart because
Okay.
if there's one thing that I want to do today is I want to destigmatize HPV infection because HPV infection is very, very, very common. It's common, commonest
Wow,
to the
so
commonest to the
many.
commonest. Okay. So
Okay.
it doesn't mean, so a lot of women don't want to do a HPV test or they do a HPV test and then they get very scared or very anxious because they feel that, oh, now I'm stigmatized. I have HPV. It means that I've been sexually promiscuous. I've had multiple sexual partners, or is my husband cheating on me? Is that why I've got HPV? Or do I have cancer? Okay,
Mhm.
so the one thing that I want everyone to know is HPV is as common as your cough and cold and your common flu. Okay, we get it, we're able to get rid of it. We get it, we're able to get rid of it. All you need to do is you need to have good immunity to be able to get rid of this infection. So it's not rare, it's common. If Even if you're healthy, even if you run marathons every month, even if you take protein shakes, even if you go to the gym, you can get you can catch HPV because it's common. Um, that HPV doesn't have symptoms. You don't have to have multiple sexual partners to be able to have HPV, right? Um, HPV will not always cause cervical cancer, like I told you before, only in a certain amount, a certain cohort of women who don't get treated early do they then change to cervical cancer. It is something that is not hereditary. You don't get it like just because my grandmom had cervical cancer doesn't mean I have cervical cancer or I have a tendency to get cervical cancer. Because unlike your breast and ovarian and your colorectal and all the other cancers that have a family predisposition, this is different. This is preventable. This is caused by a HPV virus. Okay? HPV vaccination can protect you to a certain level, but it also, at this point, we only have vaccinations towards a certain amount of strains, not covering all the other strains. This just means that even if you're vaccinated, you still need to get screened. It doesn't allow you to not be screened because I'm vaccinated. So always use the COVID um, um, example. You get COVID vaccination, you still need to test for COVID if you have, but at least that one you have symptoms since you don't have symptoms. So you still
Mhm.
need to screen. Okay. Um, what else? I have so many here.
Wow,
HPV
so
infection
many.
does not only affect young women, it affects anyone who has
Yeah.
intercourse. You don't
Okay.
have to be it doesn't have to be a man to woman transmission. So women in the LGBTQIA community still need to be screened as long as someone is sexually exposed. They need to be
Okay.
screened.
Mm.
Okay. Mm, 9 years to 14 years is a good age to get vaccinated because you want to catch these girls when they're sexually naive. You want to give them vaccinations before they start their sexual exposure. HPV vaccination does not affect fertility. It does not affect anything at all in life. It's a very safe vaccine, and it's been, there's loads of studies out there. What
Okay.
else?
What else? So
You use so many. I can just go on and
many.
on with this webinar just with
Wow.
the myths that's out there.
I just hope that the
So
audience is actually reading it while listening to you because this is very informative.
correct. So you, like I said earlier, you don't need to be promiscuous to get HPV. Using condoms doesn't eliminate your risk of having HPV infection. So
Yes.
it reduces it to a certain amount, but it doesn't eliminate it. Yeah. Screening is not painful anymore because now we're even down to screening your I mean using your own self-screen to do your HPV test. So you can have HPV having multiple partners. You can have HPV having a stable partner. You don't get HPV sharing toilets. You don't get HPV sharing drinks and food. It is
Mhm.
a close genital skin to skin contact. You don't get HPV when you hold hands. It is so this slide I came up with, or we came up with together, because many patients who come into our clinic for colposcopies after having had a positive HPV will come in anxious, telling us, doctor, I've not hugged or kissed my child from the time I found out that I've got a HPV infection because I'm afraid I will transmit the virus to my child or to my, family members. So that is not real. That is not correct. So you can go ahead and have the normal day-to-day living. Remember, this is just like a normal common cough and cold.
Okay, okay, got it.
Yeah.
All right.
I hope
Wow,
I
that's
answered your myths and your
great.
debunks.
I think that's amazing, actually. I think you've covered the important ones. I'm sure that even though I asked like just for one or two, but I think you've already covered wow, more than enough. And there's actually a lot more misconceptions as well as myths regarding cervical cancer. And of course, I think people would, because if they think of a disease, they think it's infectious or contagious. So that's why I say, oh, I don't want to hold hands, I don't want to kiss and this and that, because what if the
Mm.
virus transmits and stuff like that? But you have definitely cleared up and clarified a lot of these, anxious thoughts and whatnot. So I think, yeah, that's great. That actually answers my questions because I think we've learned quite a lot about this. And it's shocking to see how many misconceptions we have about just HPV alone, as well as cervical
Yeah.
cancer. Okay, great. So, my next question for you. Are there any lifestyle factors that can prevent cervical cancer? People usually think of food or exercise, or maybe there's something you need to change about your sex life that can help to prevent this type of cancer.
In a nutshell, I would say just have a healthy living. Do your exercises, make sure your immunity is good. If you've got any immunosuppressive or immunosuppressive disorders, get treated for it. If you're someone who smokes, we've known to have data saying that women who smoke tend to be able to clear off the infection a bit slower. So
Mhm.
smoking cessation. But other than that, nothing else. Just a
Okay.
healthy lifestyle. Yeah.
Yeah. I think by healthy lifestyle, you also need a strong immune system. So because let's say that even if you have the HPV virus, your immune system can just like fight it off on its own. So that's
Yeah.
perfectly fine. And obviously, if you have a compromised or a weak immune system, then yeah, it's definitely going to affect your chances of fighting off the HPV. So,
Mm-hmm.
okay, that's great. Yeah, so I guess people shouldn't stress too much about, oh, I have to be very nitpicky about what I eat and what I do and how many times I exercise in a week. I think that even coming from a cancer research organization myself and meeting with a lot of scientists and healthcare professionals like you, I think what's most important is that yes, you have to have a balanced diet. You just need to take care of yourself. And I think the rest will do its work. Yeah, because if you stress too much, then I don't think you'll be having a very happy or peaceful life in the first place. Yes, but I don't blame people for being worried about diseases and especially cancer because cancer it's really scary and you can potentially die from it. So I understand the fear that we have towards it. But yeah, just live a good, healthy life, and that's all you need to do, actually. I think that's the best prevention that you can have. Yeah.
Correct.
Okay, perfect. So I have one last question for you. So this one, I don't think it can be answered with any of your slides because I want to hear it from you. So, as a doctor, as a healthcare professional, what is one advice you would like to give our audience today?
If there's one advice that I want to give all the women out here, or even the men who are listening in, is that anyone with a cervix needs to get screened. Anyone with a cervix. If you know of your mum or your sister or any of your loved ones who've not had a HPV test, just tell them that's the best thing that they can do for themselves. So for this Valentine's Day that's coming up, if you want to if you want to do something good for yourself,
Yeah,
get a HPV screen
yeah,
because that will save life. That will save your life and your loved ones' lives. Yeah,
noted,
that's the most important thing. Just
noted.
screen. Yeah.
Great. Chocolates or flowers.
Yeah, go get yourself a HPV screen instead of chocolates and flowers. Yeah.
Interesting, or but interesting. Yeah, so
Yeah.
you have had a great time listening to what Dr. Yogeeta has to say about cervical cancer and HPV. I think we're learning a lot, which is great. So now that my questions for Dr. Yogeeta are done, it's now your chance to ask us any questions. Any burning questions? Okay, so I just noticed that we have like 30 messages in the chat box. So let me just go through them first. Okay, so good morning, good morning.
I think there's one participant who asked
Okay,
Leela.
let's just focus the one that's targeted towards
Yeah,
HPV and
is
cervical cancer
HPV
first.
vaccine given free of charge at government hospitals to women? Unfortunately, government hospitals, we don't give vaccines for free. But some of the hospitals, like what we are trying to do in University Malaya, is we're trying to get like a deal with the HPV vaccine company to try to give it at a lower price. But unfortunately, this is not free.
Oh, I
Only the
see.
schoolgirls get it for free.
Okay, noted. Noted.
Next
Oh,
question, Doctor from Siti Amina. Doctor, why
yes.
after 45 no need to get HPV vaccine? That's a very, very good question. So the leaflet, the vaccine leaflet, obviously when the vaccine companies come up with their recommendations, it's due to studies and due to data that they have already with clinical trials that they've done. So the leaflet would say 9 to 45 years of age. So vaccines, like I said, is best given to patients or to girls who've not had any sexual exposure. But
Okay.
in my personal practice, if I'm seeing a lady, even after the age of 45, who comes in, even if they've already had a HPV infection, once I do the colposcopy treatment, I would still offer them to have HPV vaccine because it still gives you that protection. It's just that it's off-label use.
Okay, great. I
Okay.
think there's another question from Leela as well.
How
So
many
how
doses of vaccine are
many vaccines
required for
for
coverage? So
coverage?
the new WHO guidelines even say that for young girls less than age of 14, they only need one dose, a single dose to cover, for the protection. But for those who are already sexually exposed, we would say 3 doses at 0 means your first dose, 2 months later, and then 6 months later. Yeah.
Okay, great. Hopefully that answers the question from Leila.
Sure.
And we have another one. So, if I received the HPV vaccine 8 years ago, do I need to get vaccinated again if I've tested positive for high risk HPV?
So Izati Hassan, if you've already been vaccinated, you don't need to be re-vaccinated again. All you need to do is you need to have the procedure, which I said is the colposcopy. You just need to have a colposcopy done to have a look at your cervix.
Okay, great. So, hopefully that answers the question. Do we have any more? Still regarding HPV and cervical cancer, because if there are no more questions, then I will move on to the topic about e-certificate. So come on, we have Dr. Yogeeta here who's very, very eager and very happy to answer any questions. Mm, seems that that's not a lot. I think just a few, but don't worry, maybe they're still typing or something. Anything else? Anything you want to know about cervical cancer or HPV? If you're clear, you said that, oh, wow, I've learned a lot today. I don't really have any questions. You can still type that in the chat box so that we know that you have, learned something. Oh, Shahizan said, thank you, dear doctor, because you've explained it very well. So I think it's actually
Oh,
a good
thank you.
sign that not too many questions because it indicates that you've done a very good job in explaining, the whole thing about cervical cancer to our audience today, Dr. Yogita. So bravo to you.
Thank you. So, girls out there, I just want you all to remember that getting screened for HPV is not something that you need to be worried about. Don't have to worry about the results, okay? Because HPV is very common, very, very common. All
Yeah,
we
it's
need
just
to
that we
do is
don't
just
think
get
too
screened.
much about it. Yeah, we don't think too much about it,
Oh,
like the cold and the flu.
yeah.
But
There's
there's
one more
another question
question.
from Leela. That's it. One from Leela, the third one.
A 24-year-old not sexually active, how many doses does she require? This is a bit off-label, a bit lah, Lila. So I would still say 3 doses because the immunity you have as a young girl as opposed to a 24-year-old is much different. So just have the 3 doses.
Mm. Okay, so Shahid asking about
How to donate?
so I think they're a bit confused. They've got a bit of mix up because the donation is actually related to Cancer Research Malaysia.
All right.
So it's essentially donating to our organization, but I'll let the questions go to you first before I talk a bit more about that one. So for those of you who are asking about e-certificates and donations, just stay a bit longer and I will brief you about it, okay? All right.
Okay, last question, last question. I have done
Halima.
self-test and the rest is negative. Is that reliable? It's very reliable, Halima. So if you are in the age group, if your test is normal, what you probably need to do is your next test is just 5 years from now.
Great. Awesome. And of course, if you are uncertain, like once this webinar is over and you can't see Dr. Yogita and talk to her again, you can always ask your own gynecologist. Yeah, just schedule an
You're 48.
appointment.
Yeah, the next one
Yeah,
will be 5 years from now.
48. So it's like 53.
Perfect. Yeah.
Yeah, okay, great. So I think there are no more questions. All clear. So I hope you all are very, very clear about where we're standing with regards to cervical cancer. If you're concerned about anything, please consult your gynecologist. I'm sure they would be the best person to talk to you and dispel any worries that you have in your mind. So now we have we have a few questions about donations and also the e-certificates. So, Dr. Yogita, if you don't mind, I would like to share something on my part as well. So you can
I will
stop
stop sharing.
sharing. Yeah, because they don't allow multiple. Okay, perfect. So, with regards to the e-certificate, So let me just share it first. I think you can see it just fine. Yeah, here it is. So, with regards to the e-certificate, we actually do have a process, but if this is your first time attending one of Cancer Research Malaysia's webinar, and if you're unfamiliar, so that's what I'm here for, so don't worry about it. So after today, so today is the 10th of February, so tomorrow on the 11th, you will get an email from Zoom. So it actually contains a feedback form. So all you have to do is click on the link and it will direct you to the form. So in the form, you have to fill out your details. So just so you know, when they ask for your name and whatsoever, we actually do recommend that you give us your full proper name or the name in your IC because it will actually show on the certificate. So if you put anything weird in there, then it will show as well. And of course, we will provide the e-certificate with a minimum of RM1 donation. So all you have to do is just donate minimum RM1 and you attach the receipt, the proof of donation. Over there, you can just upload it. And once all of that is done, the e-certificate will be sent to you within 30 days. But if you have any questions, maybe you're just unfamiliar with the process, or you did submit the form, but you still haven't gotten your e-certificate in 30 days, you can reach out to us at the email there. So it's de-comms@cancerresearch.my. And over at the right side, you can see that there is a QR code. So the QR code will actually direct you to our donation page at Cancer Research Malaysia's website. So that's where you can do it. So if you're interested in getting the e-certificate or just donating to support Cancer Research Malaysia, where we're hoping to support our scientists in conducting groundbreaking research on cancer. So feel free to donate to us right over there. Or if you want, over here, we have the full details over here. So you can see that our name is over here, Swift Code. So the reference should be webinar. And of course, again, all of this, you can just take a picture if you want so that you can just refer to it later. And otherwise, again, feel free to ask any questions. Wait, let me see if there's anything in the chat box. Oh, okay, great. All done. Are we all clear on the webinar for the e-certificate? So if we're all clear on that, I think that's good to go. If you need me to go back so that you can take a picture, just let me know. Anything else? Let me see. There's another one in the chat. Yep. All right. All right. Great. So hopefully that answers all of your questions regarding the e-certificate and also donations. Great. All right, so I will stop sharing now. And I have one last very exciting thing to share from Cancer Research Malaysia side. So we are a research organization that focuses mainly on, common cancers that affect Malaysians like you and I. But we also do, we have some interesting fundraising events so that you can participate and you can donate and also join us in fighting against cancer. So an upcoming one that we have is a fundraise. So let me show it to you right now. Right, so it's just like this. So, yeah. All right. So this is our very own fundraising event from Cancer Research Malaysia. Okay, sorry. The word is not very clear because of the formatting, but it's called Race Against Cancer, RAC, and it's happening this year, next month, on the 29th of March at Kuala Lumpur. So where exactly in Kuala Lumpur? Because it's so big, it's at Kepong Metropolitan Park. And it's happening from 7 a.m. in the morning to 10 a.m. So this is non-competitive. It's just a very fun, casual run. You can jog there, you can run all the way there, or you can even go skating. So it's non-competitive. It's meant to raise awareness about cancer. And of course, we want to raise funds for cancer research for the scientists at Cancer Research Malaysia. So if you're interested in participating in this very fun run, or if you want to know more information about RAC, you can just check out our social media at Facebook or LinkedIn or Instagram, and we have it all posted over there. So that's all that I really want to share with you. And again, if you're interested, QR code is just below there so that you're free to scan and you can just check it out. Yeah. So everything is just there for you on social media. I think we're all used to it by now. And yeah, hopefully I can see some of you that are interested in participating in this race. And of course, we're all in this together just to fight against cancer. All right. Great. So I think that's all from me today, and also Dr. Yogita. So I'm going to stop sharing right now.
Everyone, thank you.
Yeah. Hold on. Let me just stop sharing. Okay. Oh, can you share again the QR code registry?
Okay. Thank you,
Um,
everyone. I'm just going to
s-
take my leave. I've got a patient to go and see. So I'll see you
all
guys.
right.
Thank you
Thank you
very
so much.
much.
Goodbye. Thank you,
Bye,
Dr.
everyone.
Yogita. Thank you. All right. Thank you. Bullet share. Oh, QR code for registration. Is it with regards to the run, or is it for something else? Wait, for City Aisha. City Aisha, which one for registration? You mean for the RAC or something? Azrita is asking bullet share link attendance that e-certificate. So actually it's all sent to you via email. So tomorrow just check your inbox and you should receive an email from us. Yeah. Okay, let me just share it again. So wait, hold on. Okay, so this is the right. So over here, just to brief you all again, tomorrow you will get an email from us and there is a link to the feedback form. So all you have to do is just check your email tomorrow, and then you just click on it and just follow the steps. So don't worry, it is trilingual. So it will be available in English, BM, and Chinese. And all you have to do is just donate 1 ringgit. So you can actually scan the QR code below here to donate first. And then once you have donated minimum 1 ringgit, whatever amount you want, just take a picture and then you have to upload it in the form so that we know that you have donated. All right. So this is the QR code over here. And again, you can just go to Cancer Research Malaysia's official website and just check it there. And over here, this is the do it now QR code, which is faster. Just remember to take a picture of it. Otherwise, if we don't receive the donation, then you won't be able to get the e-certificate, yeah? All right, so hopefully that's clear. Okay, so Juliana says, asks, you've done donation, so thank you so much for your kind donation, Juliana. Really appreciate it. But how do we get the link for attendance or e-certificate? There is no attendance, it's just e-certificate. So like I said, just check your email tomorrow and you should fill out the form. All right, so hopefully that's clear for all of you. And again, would really, really appreciate it if you can join Race Against Cancer. It's something that's exclusive in our company. We have it over several locations. Maybe we might have it in Malacca or Penang or some other parts in Selangor. So yeah, definitely look out for it. Yeah, you can definitely see more information about Race Against Cancer in our social media. So check us out on Instagram. All right. So, Dr. Yogita has unfortunately gone off to attend to a patient. Yeah, life as a doctor is quite busy, but I think that concludes our webinar for today. So, thank you again to all of you who have taken the time to attend this webinar. And I think that's pretty much about it. Thank you so much and have a good day, everyone. And of course, happy Chinese New Year to all of you who celebrates in advance. All right. Hope you will enjoy your public holidays very soon for those of you who are entitled to it. Happy Chinese New Year, all of you. Stay safe and stay healthy, all right? Thank you. Thank you so much.